thank you all for having been present here and willing to learn about our child ministers for good health and well-being. As Father Joseph Justice was telling about, this is one of the sustainable development goals. This is third sustainable development goal of all the 17, and today I'm going to tell you in detail about what all our children's parliament is doing. From the point of children's parliament, I'm giving you this. So what is health? If we first understand what actually health is, health has come from the word whole. Whole means wholeness, completeness. When a person feels complete, that means he is healthy. If a person is still feeling like I'm not yet complete, in the sense like I have to gain something, in that state he is not healthy. It may be physical, it may be mental, it may be spiritual, it may be financial and environmental. All these things are recognized by United Nations as the measures for health of a being. A person, if he is physically not well, that means he is not complete, he is not healthy. This everybody can easily understand. And later it has been taken like mental health is also a very important part. So if mentally he is disturbed or imbalanced, and those things are going to cause even physical stress, that is what is called psychosomatic diseases. Because psycho means mind causing disease on the physical level. That is what is called psychosomatic disease. Today 98% of the diseases are psychosomatic, that is mind causing illness on the physical level, like blood pressure, diabetes, arthritis, migraine, like most of the things. And it has been made in such a way that everybody is assured of this kind of disease. This is what is the problem faced by the world today. So health includes that, and also it has been considered even spiritual health is also a very important aspect. So that means how happy you are, how contented you are, how loving you are, how much you are in tune with nature and everybody around. That is what the aspect of spiritual health. How much you are really contributive to the world around. This is all spiritual health. Then recently that has been considered, other things are considered are financial health. Today health has become one of the financial concerns. That means if you want to be healthy, you should have some financial support too, to provide some nutritious food, or maybe medicines, or maybe some kind of a retreat, some kind of a treatment. Everything requires financial thing. So financial assurance and health insurance has become one of the very essential things today to protect the health of a person even during his old age or any kind of a thing. Okay. Then comes environmental health. You being healthy is not enough. It's not just an individualistic. It is an environment, a conducive environment where people can naturally be healthy. So if people are not naturally healthy, like for example now we have got the epidemic, the pandemic that has come, are many kinds of things that affect. If the environment is not kept properly, then people will be affected. So environmental health is also a part and parcel of our health. So this, taking all these things into consideration, we will understand what the sustainable development goal 3 says about health. Sustainable development goal says ensure healthy lives and promote well-being for all at all ages. It is very, very elaborate thing put in one sentence. That means healthy lives and promote well-being. Well-being is also, this is not just health. It doesn't mean that your parameters are fine, but you should feel that I'm fine, I'm happy, I'm okay. So not only that, it is for all and all ages. For all, it means everyone in the world, not just human beings. For all means everything in the world, and at all ages means from conception till the last breath. Everything should be ensured a healthy life, and it should promote well-being. That means a beautiful integrity among all the living things. So this is the most wonderful, step taken by United Nations in defining its own role in doing this sustainable development goal. So this is very much important because by 2013 agenda, Sustainable Development Goal 3 says we have to achieve a progress, and for that this SDG 3 is very, very, very important. Today I am fortunate to take up this topic, which consists of 13 goals within a goal. Within this SDG there are 13 goals, which targets the Sustainable Development Goal 3. So United States has given there are 13 goals to reach to ensure healthy lives and promote well-being for at all the ages. So coming into this today in the pandemic situation of Corona COVID-19, this has become one of the most important topic. So these are some of the things. Not only just that, there is so many other things we have neglected. Today we are so much panicky about so many people dying or so many people being hospitalized, so much of pandemic spreading everything. But if you consider the total wellness of the whole world, that's not a very major thing. There are many other aspects which might have been neglected due to COVID. Because when COVID situation has become so severe, many people who have got other illnesses are neglected. Like some of the things that have been taken is maternal mortality. That is women during maternity, lot of women are dying during that pregnancy or during delivery or some kind of during that time due to maternity. So this aspect is also very, very important in Sustainable Development Goal number 3. Then neonatal mortality, that is babies at the very early age, very, very infant state. At that state, their life is very fragile. So protecting them is also one of the goals of this 13 goals among the this Sustainable Development Goal number 3. Then there are non-communicable diseases. Like most of the diseases like blood pressure, diabetes, they are not communicable, but they are more in number than communicable diseases. And then comes substance abuse. Substance abuse means drug addictions and alcoholism. All these things are also affecting the health of people. So this also is to be taken care. Then comes other things which are major in deaths, that is traffic accidents, where people may lose some limbs, may be permanently injured, or maybe they may die. All these things are to be taken care so that there are very less such incidents that happen. Okay, and then pollution and contamination is another major concern that is causing diseases and ill health among the whole world. So how do you control pollution? How do you reduce this contamination that's happening in the food, water, air, everywhere? So this is also one of the concerns of SDG 3. Then about tobacco control. Today we must have seen now, because of the intervention of the governments and everything, public smoking is completely banned. Not only that, even people are all made very much aware how tobacco is killing. How tobacco is the direct cause for lung cancer or many cancers. So this is now become like, at one time about 30 years back when we used to tell, people never cared. Today you don't even have to tell. People have become more conscious. This is all because of the Sustainable Development Goal taken very seriously. Then another very important thing is medicine for all. This is in this situation of pandemic, now we may get a vaccine, but the vaccine is too expensive for everybody to take. Very few people may afford it. Then what is the point in giving vaccine? Because it is somewhere it is going to sustain. Vaccines or medicines, these are all to be made available to everybody irrespective of their financial status. Recently we heard Infosys ex-chairman has declared that all medical companies which are producing this vaccine should provide it at the lowest cost, and the local governments or the governments of the countries and the United Nations or WHO has to bear the expenses of that, so that what happens, everybody in the world are protected. So considering this, I would like you to see one small video I'm going to share with you right now. Okay.
Every day.
Are you able to see this?
Whoever you are, wherever you live.
Everybody, are you able to see the video which I'm sharing? Yes or no?
Yes, you can
Thank you.
play it.
Throughout your life, whoever you are, wherever you live in the World Health Organization is working to protect your most precious possession, your health. Promoting a healthy diet, regular exercise, and health checks prevent diabetes, cancer, and heart disease. Monitoring how your children are growing, advising what they need to thrive, and what to do when they get sick. Recommending safe and effective vaccinations to keep the family healthy, and helping countries assure everyone receives the immunizations they need. Promoting access to safe, modern contraceptives and information on sexual health. Keeping your food safe to eat and water safe to drink. Increasing seatbelt and helmet use to save lives on the roads. Helping countries improve the quality of the air you breathe and tackle climate change. Promoting good mental health services and support, particularly for vulnerable people. Keeping you informed about health risks and how to protect yourself at home, at work, and while traveling. Understanding and planning for the specific needs of people at different ages and stages. Older people, adolescents, and people with disabilities. Fighting against deadly habits like tobacco use. Protecting people from malaria, HIV, tuberculosis, and other infectious diseases with quality diagnostic tests, medicines, and preventative tools like bed nets. Preventing infections in health facilities and tackling drug resistance to ensure that medicines will continue to work. Ensuring quality care for mothers and their babies before, during, and after childbirth. Vaccinating newborns against diseases like hepatitis B. Access to safe blood if needed. And support to ensure your baby thrives and grows through childhood and adolescence to be a happy and healthy adult. Tracking health trends and helping countries to prepare for and respond rapidly to health emergencies. Sending in experts, medicines, equipment, and supplies when disaster strikes. Helping countries to provide quality health services designed around and for people, with skilled health workers, innovative, safe, and affordable medicines, vaccinations, and other medical products, backed by the latest scientific recommendations in health information, while protecting people from catastrophic health bills. So no one has to choose between spending on health and other essentials like food and education. Every day, the World Health Organization is working with you to promote health, keep the world safe, and serve the vulnerable.
Thank you. Let's go.
This program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest UCTV.
Okay.
एक बुल के ऊपर एसिड फेंक दिया था, एसिड तो पूरा शरीर जल चुका है, तो उसको हमने ट्रीटमेंट करके सक्सेसफुली वो
Okay. Let's continue this. So, what are the essentials for sustenance of health and well-being? The first is cleanliness. Swachh Bharat Abhiyan has been taken up by India, that has been successfully implemented by our children in the children's parliaments. The next one is the awareness, like people need to be aware of what actually is happening, how they should behave. For example, now we have got this COVID, and people are not much aware of their protection by using the mask or sanitization or keeping distance from each other. So these awareness camps are being conducted, and children have been the main tool in providing the information to the community they live in. And then the service. Service is very much required in such kind of such times where we cannot completely be dependent on government to do everything. So this has been done very successfully by our children. These are the most essential things for the sustenance of health and well-being. Now coming to how INCPs can help. First is INCP means inclusive neighborhood children's parliaments. So how they can help? First is forming local teams. See, however big the project is, however much money government spends, whatever that people are at the top level involved, what comes to the bottom is most important. Ultimately, what happens at the local level is very important. When people become very much afraid, like something is going to happen, and they don't come together, then most of the things will not reach the person in need. So forming local teams are very important. Who knows what a particular person needs in their community. So inclusive neighborhood children's parliaments have been very much active, and they have played a very important role in finding out in their own neighborhood what is the need and what individuals require, and this has been done very nicely. So this is how first thing is local teams are made. Then educating the public. In this also INCPs can do a great work, because INCPs are recognized by the community, and these children, they have got access to learn what is very much important from the federated INCPs, and they will provide the real and facts for the people and educate them about how to meet the challenges. Then third thing that INCPs can do is distribution of medicine. See, a lot of medicines have come, but are we really able to really make it available to people? How is it possible? Unless people come out and take it, or how do we know whether it reaches everyone? Tomorrow vaccine comes and it has to reach everybody. The Children's Parliament can take an active role in making sure that everybody in their community, in their locality, is properly vaccinated and protected. So some such things where every individual's interest is to be taken care, INCPs can do a miraculous job. So this is how INCPs can help. So we have done in villages. This is me conducting one children's parliament in a village. In many places, children have taken a lot of activity. Children have learned and implement solid waste management, which keeps the environment clean, and they have also done tree plantation programs and Swachh Bharat, so making the locality very healthy, and also did a lot of campaigns going around making people aware that what is happening in the world, what actually we have to do, and how people can be actively involved in making the whatever that health possible to everybody in the community. So this is how INCPs have done activities, and to build a social awareness in the whole community. Because INCPs, I don't think there is anything that is not possible with INCPs, because whatever we want, it is ultimately has to reach the people. When people themselves are the participants, then it becomes easy, and it is done very effectively, because children from the childhood, when they take that kind of a responsibility, they will be able to do much greater tasks as they grow as adults. Today we have a lot of our children who have grown to be young, so they have started youth parliaments worldwide, and we have got still grown, they have become adults now, adults parliaments. Like this, children from childhood, whoever has taken up this, are able to be very effective in the taking out this aspect of health as one of the things. So one child is, and two children could be possibly, is for the health of the community. This is how Children's Parliament, Child Ministers for Health and Well-being agree to ensure that they take an oath that we children maintain hygiene, to initiate a child-led campaign against communicable diseases, and link movements like Tarumitra and all these things where they can do plantation and everything, to link with organizations that work for public health, and to promote tree plantation in our neighborhoods, promote social distancing, promote sanitizing methods, to learn from knowledgeable people on various alternative ways of purifying water, to conduct cultural programs on health awareness and well-being, to promote mosquito-free and contamination-free natural surroundings, to keep track of patients under treatment or quarantine. So they also collect success stories that they have done to promote sustainable health and well-being, making people aware that yeah, this is possible. We can really make our world a healthy place to live in. So this has been ensured by the Child Ministers of Health and Well-being. So SMS is for SDGs. SMS means what? Sanitization, mask, and social distancing. This awareness is to be built in everybody. Whenever you go out, make sure that you are keeping yourself always sanitized and in a clean and hygienic circumstances. Then use mask to protect not only yourself, others also from spreading of the disease, and maintaining social distancing. So these are all the very important things that WHO has told to protect oneself and the society from spreading of this pandemic. So SMS during COVID-19 pandemic is our motto. This is how Children's Parliament has taken up this and started making everybody understand and educate everybody in this. So here I complete this presentation. If you have any questions, please ask.